Diabetes and protein needs. Diabetes is a disorder caused by the pancreas' inability to release enough insulin to handle the blood sugar in the body during digestion. There are 3 types of diabetes: type I, or juvenile diabetes, type 2, also called adult-onset diabetes, and gestational diabetes. Each type of diabetes has its own considerations and warnings for good health. Proper nutrition is important no matter what type of diabetes has been diagnosed. Type I diabetes affects about 10% of all diabetics and is typically diagnosed at a fairly young age. Type 2 diabetes is typically discovered sometime after the age of 30, however, with so many children being obese, it is being found at younger and younger ages. The mechanisms for type I and type 2 diabetes are very different. Juvenile diabetes is considered to be a defect in the pancreas itself. The body will start attacking the organ, destroying its ability to make insulin. Type 2 diabetes, on the other hand, starts because the other organs in the body start resisting the insulin which is produced by the body. Type 2 is a progressive disease, starting with a need for dietary changes, then leading to a need for medications and eventually to needing insulin. A precursor to diabetes, prediabetes, can be present in the body for many years. Type 2 diabetes is more common in women than in men and tends to run in the family. Reduction of the risk of this type of diabetes is regular exercise and weight control. Warning signs of diabetes include increased thirst, frequent urination, especially at night, constant hunger, blurred vision, unusual fatigue, sores that will not heal, unexplained weight loss, menstrual irregularity, and chronic yeast infections. Risk stats for diabetes. Type 2 diabetes affects about 10% of all adults in the United States, with 90% of those people considered to be overweight or obese. Women who develop gestational diabetes are 20 to 50% more likely to develop type 2 diabetes within 5 to 10 years after the birth of the baby. Gestational diabetes is dangerous for the baby as well as the mother. The pregnancy is automatically classified as high risk. Source: AMA, 2005. Risk factors for diabetes include being more than 20% over your ideal weight, having persistent hypertension, having poorly controlled blood cholesterol, having a family history of it, especially in parents or siblings, being of certain ethnicities, including African American, Hispanic American, Native American or Asian American, or having gestational diabetes or having had a baby that is over 9 pounds, with or without the diagnosis of gestational diabetes. Testing needs to be done, including fasting blood sugar, A1C testing starting at 45 and completed every 3 years unless there is reason to test more frequently. Those who are at higher risk may need to be tested every year. Protein needs in diabetes. Type 2 diabetes can be controlled with diet. Just a small reduction in weight can typically eliminate the need for medication. Diabetes, if left unchecked, can lead to some very serious health risks, including an increased risk for kidney disease, blindness, heart disease and amputation. Protein plays a very vital role in not only helping to lose weight but in stabilizing the blood sugar levels that can be so hard to control for the diabetic. When the body digests food, it is broken down at a rate based on what it is made of. Fats and simple carbohydrates break down very quickly, while complex carbs digest at a slower rate. Proteins break down very slowly within the body and require more work by the body. This creation of energy also causes increased heat, a phenomena called thermogenesis. Only alcohol creates more thermogenesis than protein. Source: Westertup. Fats are broken down to fats, carbs are broken down to be used for energy, and protein is used as the last resort for energy but is used by the body for a large range of other functions. Protein is important in the body, but can be dangerous if it makes up too much of the diet, especially in the presence of heart or kidney disease. The American Heart Association recommends that the upper limit of protein intake be no more than 35% of the daily calories. However, each diabetic's doctor will set specific dietary guidelines. A person with stages 1 to 4 of chronic kidney disease should strive to limit protein because of their disease, but within reason and only under the direction of a doctor, a dietitian or a nutritionist. Source: National Kidney and Urologic Disease Information Clearinghouse. For weight loss purposes, calories should come from carbohydrates, 50%, proteins, 30 to 35% and fats, 15 to 20%. The higher level of protein makes the diet more satisfying without deprivation. Source: The American Journal of Clinical Nutrition. The protein need in the body is so great that if we do not get the right amounts, the body will eat more food to make up for it. Source: Massey University, 2009. The more food that is needed, the more calories will be ingested. It is a myth that protein does not turn to fat in the body. If there is too much consumption, the body will store it as such. Protein comes from 2 sources, plants and animals. Plant protein, with the exception of soy protein, is incomplete because it lacks 1 or more of the amino acids that the body needs to have supplied by the diet. Because they are incomplete, vegetarians need to make sure that their diet is balanced and varied so that they do not miss out on any of the essential amino acids. The typical vegan diet gets about 10 to 12% of its calories from protein, while the average diet is 14 to 18% protein. Source: Mangels. Animal protein is complete and comes from sources such as meat, dairy, and eggs. Leaner protein sources should always be selected so that the diet is lower in saturated fats as well as calories. Good animal proteins include tuna and salmon as well as other fatty fish. Turkey is another good protein source, specifically roasted, skinless breast meat. Low-fat dairy products and eggs are also excellent sources of animal protein that can work well in the quest to lose weight and be healthier. Protein supplements are also important to add to the diet but should be of specific types. Some may be loaded with additional sugar, which can cause too much blood glucose. ProfectR, from Protica, is a small liquid supplement that supplies 25 grams of protein in only 100 calories with 0 fat and 0 carbohydrates. In addition, ProfectR supplies both vitamin C and vitamin B complex. Be wary of protein bars, especially those with candy-like flavors, as they may have enough calories or high enough sugar content that they are equivalent to candy bars. Diabetics should discuss their supplement options with their doctor for optimal health. There are certain brands, especially of protein shakes, that are specifically designed for diabetics. Protein supplements have the advantage of stabilizing the blood sugar and preventing hunger between meals.